When it comes to breast cancer, early detection can truly be the difference between life and death. Here to share insights about early detection and comprehensive breast care is Dr. Huang, Medical Director of Capital Health Center for Comprehensive Breast Care. This is Health Headlines, a production of Capital Health. I'm Jamie Lewis. And Dr. Huang, thank you for being here.
Thank you so much for having me, Jamie.
Can we start with why early detection is so critical in the fight against breast cancer?
So we know that early detection saves lives. When breast cancer is found early, it's often smaller, has not spread, and it's just much easier to treat. In fact, we know that when breast cancer is caught early, the survival rate is often over 99%. So finding the cancer at the earliest stage means we can use less aggressive treatments, such as preserving the breast by doing smaller surgeries, and then sometimes it eliminates the need for additional treatments like chemotherapy.
Can you walk us through some of those recommended screening guidelines, like who should get screened when and how often?
There are some variations on when to start screening from the different guidelines and medical societies. However, I would say most would agree that for women with average risk, screening should start at age 40 and then be done yearly. There's no current guideline as to when to stop screening. Most breast providers will determine this based on someone's overall health, their functional status, and their personal goals. Now, if a woman has additional risk factors, such as strong family history, genetic mutations, or if they have dense breasts, sometimes they may need to start screening earlier or may require additional imaging studies.
Well, what are some of those key risk factors and warning signs that folks should look for and be aware of?
There are several key factors that can increase someone's risk of developing breast cancer. Some of it is simply out of our control, for instance, our age or gender. Breast cancer is 100 times more likely to occur in a woman than man. We do know that as we get older, our risk of cancer increases. And also genetics plays a role. For instance, someone with a change or mutation in the BRCA gene can have up to 85% risk of developing breast cancer in their lifetime, compared to the average woman's risk of just 12%. However, there are some factors that we do have control over, such as maintaining a healthy weight, limiting alcohol, avoiding smoking, and staying active. These are lifestyle changes that have been shown to reduce breast cancer risk. As far as warning signs people should look out for, that should include a new lump in the breast, some crusting of the nipple or nipple discharge, especially if it's bloody, some skin dimpling or redness, or changes in the shape of the breast. Basically, anything that feels new or different really should be evaluated by your doctor. Now, not all lumps are bad, but when in doubt, I think it's better just to have it checked out.
Definitely. Well, you mentioned genetics. How can people with a family history of breast cancer better understand and then manage their risk?
I think the first step is really just knowing your family history and sharing with your doctor. If you have multiple first or second degree relatives with breast or ovarian cancer, for instance, you may benefit from genetic counseling and testing. You may also be referred to a breast specialist, such as myself, for high-risk assessment. We can help patients with a strong family history better understand their personal risk and then create a tailored plan. Sometimes this may include earlier screening, more frequent clinical breast exams, or adding additional imaging such as a breast MRI.
I love that Capital Health has a high-risk program that's so critical for those who need it early on. And for those who are considered high risk, how does that program help them stay ahead of a potential diagnosis?
We have a great high-risk program. It's really designed to take the guesswork out of it. We do a detailed risk assessment based on a patient's personal data points and their history, and then create a personalized plan for them. For many patients, that may mean a clinical breast exam every 6 to 12 months, annual mammogram and breast MRIs, usually spaced about 6 months apart. And depending on their level of risk, some patients may actually benefit from taking additional medication or consider undergoing risk-reducing surgery if their risk is very high. We also offer lifestyle guidance and ongoing monitoring, so patients really won't need to navigate this alone.
That's wonderful. What kind of diagnostic testing does Capitol Health offer, and who is that for?
We offer a full spectrum of diagnostic testing at Capitol Health. 3D mammogram or tomosynthesis is now the gold standard for breast cancer screening. It's really improved our ability to detect earlier, smaller cancers and then limit the number of callbacks for additional studies. Now, be aware that some facilities still perform 2D mammograms, so you should always request for 3D when available. We also offer breast ultrasounds in women who have dense breasts or when they have a breast finding that needs a closer look. We perform breast MRI for high-risk patients, as we previously discussed, or if we need additional details such as after new cancer diagnosis. We have fellowship-trained breast radiologists on site every day to perform biopsies if needed, and this can be done by mammogram, by ultrasound, or MRI guidance, depending on what's the best way to approach it. Now, if someone needs to undergo surgical removal of a breast finding that cannot be felt on exam, our radiologist can help us place a small wireless seed about the size of a grain of rice at the target area, which will then allow us surgeons to precisely find that lesion and really decrease the amount of tissue we need to remove. It really is truly amazing how far we have come in terms of advancements in imaging and technology to really help us find cancers earlier and to be able to perform less invasive procedures.
You mentioned earlier some preventative measures like avoiding alcohol, quitting smoking, those kinds of things. Can you talk a little bit more maybe about how people can stay proactive about their breast health over the course of the year beyond just doing those annual screenings?
Yeah, I think the most important thing is really to know your body and really pay attention to changes in your body. I always recommend to my patients to do a monthly self-breast exam. Really just be familiar with your breast can help you recognize if something looks or feels different so you can have it examined. And as you mentioned, try to lead a healthy lifestyle with regular exercise, limiting your alcohol, and maintaining a healthy weight really has been shown to reduce someone's risk. But the most important thing, I think, is just keeping up with your regular checkups and then let your provider know, really, if you notice anything new or different.
Well, if someone is diagnosed with breast cancer at your hospital, what kind of care and support can they expect from that point on?
So at Capitol Health Cancer Center, we really have a very comprehensive team specifically focused on breast cancer care. So we're an NAPBC accredited breast center, which is granted to the top breast programs in the country that offer the highest quality of care in terms of breast disease. Not only do we have specialized physicians, so that includes fellowship-trained breast surgeons, radiologists, medical oncologists, radiation oncologists. We also have nurse navigators, genetic counselors, nutritionists, lymphedema specialists. The list goes on, social workers that really help support our cancer patients throughout their cancer journey. We meet about once a week at our tumor board to discuss new cancer cases and active patients, and we have a research team that help enroll patients in clinical trials. We offer an on-site spa and wig services right here in our hospital. So I'm really proud to be part of a breast center that can offer access to such a wide array of services to our patients right here in the community.
Wow, that sounds incredible. What a wonderful thing to have all of those different services in one place. If someone is looking for more information on Capitol Health Center for Comprehensive Breast Care, or if they want to make an appointment for an annual screening, where should they go?
They can find more information or request screening by calling 609-537-6767 or by visiting capitalbreast.org.
Is there anything you want to leave with our audience about breast health and the importance of early detection?
I think the most important thing is to stay on top of your health, follow up with your doctors, and notify someone if you notice any changes.
Well, thank you so much for all that valuable information and insight. We appreciate it.
Thank you so much.
That was Dr. Huang, Medical Director of Capitol Health Center for Comprehensive Breast Care. For more information on Capitol Health Center for Comprehensive Breast Care, visit capitalbreast.org or call 609-537-6767. And thank you for listening to Health Headlines.